welcoming you, sir, respected speaker of the session, Dr.Krathish Bopanna, sir, and my dear teachers, students, and all other fellow pharmacists to the webinar. You're all welcome for the webinar series 13. Today's topic is regulatory mechanisms and responses of omega-3 fatty acids and relationships with vitamin D. Before starting the session, we will have a brief introduction, probably. Maybe if at all I start speaking about sir, the whole session may be occupied. So let us have a small introduction about Krathish Bopanna sir. So here Krathish Bopanna sir, over 23 years of experience in large global pharma, large information technology in contract research organizations. Sir has worked as a C-level executive for over 13 years, managing P&L of products, sales, finance, information technology, marketing, and other services across the world. Some of the leading companies worked include AstraZeneca, Tata Consultancy Services, Manipal Group, which is the largest healthcare institution, and Next Bio Research Labs and similar group of companies. Currently serving as director in the board of health, nutraceutical, sports, and medical devices companies. In the last 2 decades, Sir was actively involved in building all the functions that include intellectual and technological edge for the respective companies in the leadership role. Sir has been a key decision maker, working with his peers and superiors globally in shaping up companies for its future directions. Thorough understanding, impact of pharmaceuticals, biologicals, devices, and diagnostics in the healthcare scenario from efficacy and safety perspective. Thought leader in the field of clinical and drug development that includes being past president of Indian Society of Clinical Research, advisory council member of DIA, past member of National Committee in Health and Family Welfare, Government of India, Board of Management, JSS Medical University, Mysore, and so on. Sir has a doctoral degree in the field of psychopharmacology from the National Institute of Mental Health and Neurosciences, Bangalore, India, and honorary doctorate in science from IUCS, Washington, DC. Postgraduate in pharmacology from MS University of Baroda, Baroda. Sir is a gold medalist in the graduate. I'm underlying for all the students so that they can take the inspiration. Sir is a gold medalist in graduate and undergraduate programs with over 30 publications and 50 presentations in national and international conferences. Sir personally examined and guided number of graduate, postgraduate, and doctoral programs. Sir is an adherent golfer and represented India in World Finals of Duke of Edinburgh World Finals and stood second in the lineup of the 20 countries. This is the shortest introduction we can give to Sir. So as it is 3:31, as we are all eagerly waiting for the session, I hand over the session to Sir to speak.
Thank you, Nagashri, for a wonderful introduction. It's important that, thank you, Vishwanath, for giving me an opportunity to come and speak. And it's my pleasure. Vishwanath is an old friend. We have grown together, and I've seen his progress and his institution. I've been part of some of the sessions where he invited me to come and speak. This topic is very, very dear to me for several reasons. One, of course, it is very important today in passing through one of those worst times of the world, possibly one of the worst instances post World War II. That's what people tell. It has not only just created havoc and confusion in the minds of the people around the world, but also has created a lot of insecurity amongst growing people, as well as parents, senior citizens, and of course professionals like us. Now, to be very specific, I just want to start my talk because many a times in life we meet extraordinary people of excellence by sheer accident. Sometimes destiny drives you to places where you are to get the seeds of greatness. And one sheer randomness is me reaching MS University of Baroda for my postgraduate 25 years back. I was in two minds whether to take up the admission or move forward in my expedition, like most of your students, to find another college was my dilemma. In this quest, I found a rarity in a person, which made me to take up a seat and pursue my postgraduate studies in Baroda. Here is a person who became my teacher, guide, mentor, friend, and everything. My teacher and our teacher, Dr. Balram. My thoughts were at the speed of light. It was not matching with actions, but never ever condescended the process of my thinking and or behavior or said anything which would break the speed at which I was thinking. He encouraged me to explore realms of pharmacology and derive my pleasure of this subject. Today's topic is a classical example. When you deep dive into the subject, the satisfaction or ecstasy you derive is a pleasure for your mind, heart, and your soul. Today, this talk is dedicated to my greatest teachers of pharmacology, Dr. G. Parthasarathy from JSS Pharmacy College, Mysore, and Dr. Balraman, pharmacology professor at Baroda University. They're then professors. Both of them have moved out in their career, but I want to dedicate my talk to them. My humble pranamas to them. And because of that, today, what I am today is this topic will find for you very, very interesting. And it's important for you also to understand why there is a regulatory mechanism, why there is an importance of essential fatty acids, and why there is a relationship between essential fatty acids and vitamin D. So I'll come back to the details of that as we move forward. Okay. Hope my audio is clear. If there is any problem in the audio, coordinator, please allow me to stop, speak slow, or speak fast, whatever it is.
Yes, sir. Sure, sir.
Okay. The rapid progress. The next slide, please. Next slide. Second slide. Okay. Now, Joseph Priestley, who was inventor of oxygen. So Benjamin Franklin written a letter to Joseph Priestley in 1780. Please read this carefully. The rapid progress science now makes, my regretting sometimes was born too soon. It is impossible to imagine the height to which may be carried in 1,000 years the power of man over matter. Perhaps deprive large masses of gravity, give them absolutely for the sake of easy sport. Agriculture may diminish its labor and double its producers. All diseases may be sure means by prevented or cured, not expecting even that of an old age, and our lives lengthened at pleasure even beyond the antediluvian standard. Oh, that moral science were in a way of improvement, that men would cease to be wolves in one another, that human beings would be learn what they know properly called as humanity. This is a letter written years back to the inventor of oxygen, Joseph Priestley, by Benjamin Franklin. Next slide, please. Today in my presentation, next 35 to 40 minutes, I will be trying to talk to you about the current status of supplements intake, how drugs are important, supplementations are equally important, the role of vitamin D and omega-3 role in human body. Third, I'm going to talk about basic mechanism of polyunsaturated fatty acids and vitamin D, clinical outcome based on the combinations, and finally the summary. Next slide, please. So coming back to vitamin D. So vitamin D is more like an hormone than a vitamin. It is a function in the body is getting redefined. Its function in the body is getting redefined. It is a fat soluble vitamin and not available for biosynthesis in the body directly. Unless one is exposed, however, on the contrary, we have UV rays leading to skin cancer, right? When we are going out to sunlight, when you're getting sunlight today, people say you should be extremely careful about UV light because you may get a skin cancer. Potential risk of cancer leads to emergence of several sun protectors you may be looking at in the market today. Several sunscreens or sun protectors are available today, which actually further worsen the levels of vitamin D synthesis in the body. Now, let me tell you a paradox, how life is all about. It's now, most of us have a different color skin when we compare to people in the West, because our skin contains high amount of melanin. Now, increased melanin content disallows the penetration of sunlight into the skin, because sunlight has to go through the melanocytes in the skin, because penetration of sunlight through melanocytes through skin epidermis challenge. One recent study conducted at a Ludwig Hospital, Schaffen General Hospital, amongst 2,790 Caucasian patients who were admitted to coronary angiography exposed to UV light in a range of 290 to 400 nanometer produced considerable physical stress on the skin that induced dehydration and damage. In order to protect the skin, epidermis armed with melanin produced capacity, mainly a chemical called as eumelanin or black melanin, to protect epidermal cells. This protectant can maintain cellular and epidermal homeostasis. This acts as a sensory and a regulatory cells of epidermis. Vitamin D gets absorbed well in the presence of a lipid environment. Now look at a beautiful story about your nature. Now you need vitamin D. Vitamin D is produced in the body through the exposure of sunlight. Now we human beings, especially Indians and most of the people in the Middle East and Western India, the west part of the world, has a high amount of melanin in the skin. Melanin disallows the passing of a sunlight to the skin because melanocytes need to be stimulated. Now, but on top of that, we are scared about that vitamin D. We are scared that sunlight can produce damage through UV rays and cause skin cancer. So, by dual mechanism, we are avoiding vitamin D not synthesized in the body. Now, here comes a question, which is important: sunlight, vitamin D, melanin, or sun protecting creams? These are the few questions we have to ask ourselves today. On top of that, today I'm saying vitamin D is not a vitamin anymore. It's more like a hormone in the body. Now, how does vitamin D gets absorbed? Now, vitamin D gets absorbed in presence of a lipid environment because it's a fat soluble vitamin, and hence essential fatty acid is a part of the supplementation goal. So when I talk about supplementation goal, I like to add vitamin D with omega-3. Besides acting as an additive effect, it is seen that omega-3 is also been established as a universal supplement for various functions of the body. Now, let me get into a little bit about what is a omega-3 fatty acids. Omega-3 fatty acids is involved in human physiology. You have to please carefully understand. All these omega-3 fatty acids are basically carbon 18, carbon 20, carbon 22 compounds. So the basic one is C18, which we call as alpha-linolenic acid, with 3 double bond present mainly in vegetables, fruits, or or plant kingdom in general. They are not present. C18 is not present in animals, or so it's more present in botanical sources, and generally it is present in walnut, edible seeds, algal oil, flake seeds. Now something called as hemp seed oil from cannabis, through which works on a receptor called as bliss receptor or anandamide receptors in the body. So it's a different type. So this is all C18 form of omega-3 fatty acids. But there are also C20 with a 5 double bond, are called as docosahexaenoic acid, or C22 with 6 double bonds called as, which is DHA is C22 with 6 double bond called docosahexaenoic acid. C20 with 5 double bond is called as eicosanopentanoic acid. There is also another C22 called as docosapentanoic acid. So we have these sources like EPA, DHA, DPA, which is present in fish oils like squid, krill oil, salmon, or in cod liver oil. We find these oils. So there are several theories that alpha linoleic acid can synthesize eicosapentanoic acid or docosapentanoic acid, but which is still a theory. But there are no non-conclusive evidences that in mammalians you can convert this into a EPA DHA, which is very, very important. C18 getting converted into C20 or C22 omega-3 fatty acids. In summary, a healthy, balanced diet should have vitamin D and omega-3. Why, how, I'm going to discuss in the next few slides. From heart, from immunity, and from a neurological perspective, why this is very, very important for your body. Okay. The next slide, please. The slide number 5. Slide number 5 talks about the current supplements intake. This is the data that I has picked up from an international journal, which talks about macro supplementation and a micro supplementation. That is macronutrient or a micronutrient. The macronutrient, sorry, please can you not talk in the middle, please? So it disturbs the thought process and disturbs others also. Thank you so much. Now, the macroeconomics, macronutrition are essential omega-3 fatty acids, and micronutrients are vitamin D, multivitamins, vitamin C, calcium, vitamin B complex. If you look at people in America in 2017, the highest supplement taken on an everyday basis, out of the 5 people, 1 person in America is taking omega-3 fatty acid. That means out of 300 million people in America, 1/5 is about 40 million people consume omega-3 fatty acids every day in United States of America. Every 4th person out of 5th person, that is out of 300 million, 250 million people take everyday multivitamin. At the same time, vitamin D is consumed in 37% of the population. That means indirectly 1/3 of the people, that means 100 million people take vitamin D every day. That means in reality, in Indian context, out of 130 crore of people, about, at least according to us, about 500 crores, 400 to 500 crores people have 400 to 500 million people, 40 to 50 million people need to take vitamin D if you go by these statistics. So it is a very, very important item here. So which is also talks, it's important for us as scientists and pharmacologists to look at all the treatment strategy and basic mechanism of these 2 nutrients that regulate in general cause and effect of these products in general. It is an evolving science, and my emphasis here is to establish its role in cardiology, immunology, and in neurology. Next slide, please. Slide number 6, please. Okay. If you look at vitamin D and omega-3 role in body, see, if you look at the image here, where right, you can see fish and you can see and next to the fish is a mushroom. Then you have orange block, which is nothing but a salmon fish. Then you have a lemon. Then you have a cheese. Then you have egg. Then you have blocks of cheese, isn't it? You see a lot of food items here. Why it is important? Low omega-3 will lead to poor visual and cognitive development. It leads to Alzheimer's disease and other forms of dementia and cardiovascular diseases. Low vitamin D will lead to cancer, infection, autoimmune diseases, and cardiovascular diseases. Next slide, please. Next slide. So what are the potential effects of using omega-3? Large clinical studies, which we will discuss further, has shown some potential effect of omega-3 on electrical properties of heart, thereby reduces arrhythmias and some improvement in autonomic function. It is also shown to decrease platelet aggregation, produces vasodilatation, decrease blood pressure and heart rate, high inflammatory activity, improvements in endothelial function, reduced triglycerides, and improvement in vascular and cardiac hemodynamics. Indirectly, although are related to the dose, and some of them accomplished with your dietary intake. Now, generally, typically, dietary intake as per RDA requirement recommends minimum of 750 milligram per day of more of omega-3, and some of those guidelines, which I'll a little later, recommends close to 4 gram per day of omega-3, which we discuss further. Vitamin D deficiency are more earlier related to bone health. Earlier people used to talk vitamin D deficiency lead to bone health. Now its role in health is changing every now and then. Some of the reasons for the deficiency are dark pigmented skin. As I mentioned earlier, homebound like lockdown times, during lockdown times, and people are staying inside the house. Increased distance from equator. Somebody goes a distance away from the equator, their vitamin D levels are lower. Winter seasons, during winter season, sunlight is low. Elderly people who lose ability to get exposed to light, dietary absorption not amount. Sun protectors, pollution, smoking, obesity, malabsorption, renal disease, liver disease, due to
Vitamin D and omega-3 role in human body.
medication that includes glucocorticosteroids,
ये मुझे अन्य दिखाता
glucocorticosteroids, convulsants, retroviral, and anti-rejection drugs are main cause of reduction of vitamin D and omega-3 role in human body. Next slide, please. And please mute, please don't talk in the middle, please. Next, please. Okay. This slide talks about what is a positive mechanism of increased cardiovascular risk of vitamin D deficiency. This slide is a clear picture when there is a deficiency of vitamin D, which leads to parathyroid hormone, increase in parathyroid hormone. Now, increased parathyroid hormone will increase insulin resistance, plus it's also increased pancreatic beta cell disease. Now, diabetes type 2, it is non-insulin dependent diabetes mellitus, is nowadays not related to increase or decrease in blood glucose. It's mainly due to increased insulin resistance, sensitive insulin. Increased parathormone, we find increased renin-angiotensin aldosterone system. Today, you may be hearing a lot in television when you read about SARS-CoV-2. SARS-CoV-2, that is what is severe, what is severe acute respiratory syndrome, coronavirus 2, attaches to ACE2 inhibitor, which you all know that people who are consuming ACE2 inhibitors or ARB blockers, angiotensin blockers, are highest to die today. So this explains the mechanism why vitamin D has a role to play in SARS-CoV-2, because vitamin D deficiency will lead to increased angiotensin system, increased hypertension, hypertrophy, diabetes and metabolic systems, hypertension and hypertrophy, increase atherosclerosis, and number of cardiovascular events. So this is one of the reasons why I thought it's important for you to know before I go for the next slide, please. Somebody's talking. This is atrocious. Can you just mute the telephone, please? Physiological effects of N3, that is omega-3 polyunsaturated fatty acids, that might influence the cardiovascular risk. Now let's look at the entire slide. Now if you look at the slide, it is divided into 4 different buckets. On the way right, when you visualize the slide, is the heart. When you go down, way right, down towards the right. So left leg for you. In general, it is thrombosis. On the extreme left is endothelium. Extreme left corner high is a triglyceride. This is an interesting slide. It has a profound impact of omega-3 fatty acids on the cardiovascular disease. Green color boxes. Can you see a green color boxes? Green color boxes, that's bottom down. You can see it's in all the 4 places you see a green boxes. The green color boxes clearly shows that dose response relationship is not established. That includes effect of myocardial efficacy, vagal tone impacted by your cholinergic system, a left ventricular diastolic filling in heart, possible effects of glucose release on the gluconeogenesis in liver. And you know, gluconeogenesis is formation of glucose other than the original source of carbohydrate. It could be proteins or from fats. Systemic vascular resistance in blood vessels, or decreased production of eicosanoids or its derivative. However, look at now, heart rate, arrhythmia, and blood pressure is dose linear with the dietary intake of less than 750 milligram. Now, for example, if you increase the dose of 750 milligram of omega-3 daily basis, you could see some changes in heart rate, arrhythmia, and blood pressure, which is dose linearity, which can be seen here. However, the highest dose of 7 gram to get appropriate, to get a reduction of triglycerides in the body, to increase HDL levels in the body, you need a dose of close to 7 gram of omega-3 fatty acids per day. So lower dose of 750 milligram or 1 gram per day will not give you benefits on triglycerides. Now, one of the important factors today we see is blood clotting factors. Reduced thrombosis is seen at doses of greater than 4 gram per day. Suppose if you take omega-3 fatty acids for 4 gram per day, it is shown in number of clinical trials that there is a thrombotic reduction, that is blood coagulation factors are reduced. This is just to give you an idea. Recommended doses by American Heart Association is about 3 gram per day. American Heart Association recommends about 3 gram per day, whereas European Union recommends a dose of 5 gram per day. So you can imagine how important usage of omega-3 as recommended by American Heart Association and also recommended by European Heart Association. Next slide, please. Next slide is a busy slide. Next slide, please. Yeah, I love this slide. It's a beautiful slide. This shows how chaotic is our journey of chemicals that is produced. Melvin Matthew, can you just not talk, please? How love this slide because how chaotic is our blood carrying omega-3 fatty acids in the blood. Now, if you look at our body structure, what happens inside the blood vessel is chaotic and confusion. What happens in the cells are beautifully organized. God has been kind to create that structure inside the body, which does a wonderful job. You should know there is a perfect synchrony of action inside the cell. If you understand your cell well, cell contains beautiful organelles that includes cytosol, includes mitochondria, endoplasmic reticulum. I love the Golgi role Golgi apparatus plays, nucleus, lysosome, and inner membrane of the cell. Now, inner membrane of the cell, if you look at the inner membrane of the cell, it is managed by a host of voltage-gated sodium channels, fatty acid transporter, and G protein receptor-mediated signal transduction through nuclear receptors. We will definitely spend some time on this slide, which will help you to establish your complete understanding of the action of omega-3 and its role in immunity. Now, if you look at, you should understand very well, there is a beautiful transporter of omega-3 present in the brain. On the inflammation cascade, if you look at this slide, omega-3 fatty acids compete with your arachidonic acid cycle in the body. You know, arachidonic acid is responsible for causing inflammation through initiating phospholipase A2, thereby produces your leukotrienes, prostacyclines, and thromboxanes. No, sorry, thrombotics product. Now, what happens here is omega-3 compete with arachidonic acid, reduces the expression of arachidonic acid metabolism, and thereby increased production of good cyclooxygenase, good prostacyclines, good leukotrienes, and good thrombotic inhibitors in the body. Thereby, it initiates number of sequencing happens in the nucleus of the cells. Now, this happens both in skeletal muscles, also in your brain. Now, you can see in your slide on the right, there is something called as lipid rafts. Lipid rafts are known as lipid microdomains, which are discrete lipid domains present in the external leaflet plasma membrane. Rafts are completely enriched in cholesterol, glycosphingolipids, and glycosyl phosphatidyl inositol, which we call as GPI, anchor proteins, and are insoluble low concentration for non-ionic detergents. Here, omega-3 influences the lipid rafts, thereby increases the membrane fluidity, thereby decreases sodium ion concentration, cytosol situation, and myocyte excitability. That means it helps in action relaxation of the omega-3 interacts with membrane proteins like G protein 120 on the cell membrane, thereby signals cascades of nuclear factor B and extra signal regulated kinases to produce fatty acid synthase. Finally, omega-3 needs to synthesize fatty acids in the body, of fatty acids. Production of fatty acid synthase is influenced by three important regulatory items or binding proteins called SREBP1, SIEVP1 is steroid regulatory element binding protein 1C. Retinoid X receptor, and my favorite, PPAR gamma peroxisome proliferated activated receptor. So now you can relate. If you know this very well, how does it work to reduce the triglycerides? How does it work on reducing diabetes in the body? So you should understand the role of omega-3 in inflammation. Find when they cut down your body and start relating it much into the deeper sides, you should know that most of the work that happens, most of the action that happens in the body is inflammation. You need nutrition to reduce the anti-inflammatory action or antioxidant action in the body. The next slide, please. This slide, so it's clear from the last slide, you know how neutrophils. So neutrophils and platelets play important role in producing resolvins and protectins. Immune system is defense systems organisms from invading pathogen. Now, if you look at an organism like COVID-2, which gets stuck into the nasal epithelium and stay in your body on the face, in your nasal tract for 1 or 2 days. That's the reason people take a nasal swab, estimate the value of see the quantitative estimation of these organisms in the nasal swab to give you that PCR reading today. Now what happens? Good resolvins and good protect, it will throw away microbes or virus from your nasal tract. The immune system is a defense system that protects organisms from invading pathogens such as viruses or bacteria. It comprises a heterogeneous group of cells, what we call as immune cells, as well as cell-independent mechanisms like T cells or B cells, which are secondary immune system, which I'll come back to shortly. Immune cells as well as cell-independent mechanisms can be broadly divided into 2 categories of defense systems, which we call as acquired immunity or innate immunity. Is what we got it. Acquired, we build it over a period of time. Now, if you look at which are the cells, students, it is important for you to know that the simple, if you look at your white blood cells, you have neutrophils, eosinophils, basophils, responsible for your primary defense mechanism. Plus, you have macrophages, mast cells, natural killer cells, and dendritic cells, so nerve cells are responsible for your natural innate or from inborn immunity. But your body has in the white has lymphocytes, which is responsible for your, which contains B cells and T cells, which are responsible for your secondary defense mechanism, are also called as secondary defense mechanism, also called as acquired immunity, build up immunity. So it's important. The ancient immunity is a build up immunity, acquired immunity. Innate immunity is not, the specificity is less. Next slide, please. So I will not dwell too much into it, but please understand, as I told, vitamin D is absorbed from sunlight. 80% of your body vitamin D is synthesized through the exposure to sunlight. Only 20% from dietary intake. So as I said earlier, vitamin D comes in form of calciol, which gets converted into calciol in kidney, which forms a majority circulating form of vitamin D. In kidney, calcidiol is converted from active form of calcitrol, which circulating different tissues and organs. Calcitrol will bind to vitamin binding protein and crosses the plasma membrane to produce cytosol vitamin D receptors, and with the help of retina,
Wait. Voice is not clear.
Lost your signal. Just be patient. Sir will be back.
Thank you, ma'am.
You please mute yourself. I request all the participants to be with us. Sir will join us soon. Maybe there is a connection problem. Please stay with us. Sir will be back in a few minutes.
Hello. Hello, ma'am.
Hello.
In the meantime, can I request you to go back 2 slides?
Hello.
Hello.
Hello. So some participant was asking a slide. Before sir will join, I would like to take up your request. This is
Yeah.
the slide, sir.
No, you have to go back.
Just a minute, sir.
The slide where he was showing the deficiency, I think it is 2 slides more you have to go back. Just go back one more slide. Another slide, just the previous one. Yes. 1 second.
This is
Thank you. Thank you so much.
A pleasure, sir. Please, I request all the participants to be a little patient. We are all trying to reconnect to sir. We are in that process. We regret the inconvenience. Please stay with us. So before sir gets in touch, I would like to tell you all the participants, please submit your feedback because it is suddenly shifted from Google Meet to this one. Those who have registered with the Google Meet, we may not be able to get your Gmail. So please kindly submit your feedback through the feedback link, which will be shared in the last in the chat session. If at all you don't get a feedback, please kindly mail yourself up to online teach link at gmail.com. I repeat it, online teach link at the rate of gmail.com. Please, if at all you don't get, by any chance after attending this session, you don't get into this feedback, you please can mail yourself up your certificate on which how you wanted. So you please mail yourself up so that you will receive your certificate.
okay.
Hello.
Please share the PPT on register minute.
Hello. Hello.
Hello.
I'm
Yes, sir.
online. I'm
Yes, sir.
online.
Yes, sir. Yes, sir.
Okay.
Participants are also with us, sir.
Okay, no problem.
Yeah.
I think there's some technical issue. I don't know. I got thrown away.
Yes, sir. No problem, sir. Continue, sir.
Yeah. So can we go to the vitamin D? That's slide number
As
12, 13. You can go to slide number 13, please.
yes, sir. As meanwhile, they were requesting for your previous slides. I changed it. Just a minute, sir.
Okay. So what I will do, I will not get into too much of details about the slide number 13 because interest of time. So what I will do is I will straight away get into slide number 14. Go to slide number 14, please.
Yes, sir.
Okay. Yeah, slide number 14, please.
Just a minute, sir.
Yeah. Slide number 14.
I think I stopped sharing. Meanwhile, I was reaching to you.
Okay. Slide number 14, please. So I have about 15 minutes time, right?
You can extend it also, sir. We are loving your session.
Okay. Okay. I can see.
Now, technical problem is with me, I think, sir. Just a minute. I stopped the share actually.
Yeah, take your time.
Can you see, sir?
I can't see. What are fucking people?
Hello, sir.
Hello. Yeah. So
The point is, sir, share screen.
please share the screen, please.
నాకు అది రావట్లేదు ఎందుకని.
Slide number 14.
Okay. Sir, can you try
Slide number
opening
14.
your laptop, sir? Can you try opening in your laptop?
No, I'm not possible because my laptop is disconnected. So then I connect from a mobile now.
Okay. Sir, చెప్పండి sir. Suchitra ma'am. Oh, okay. Yes, sir.
Ram, Ram, why can't you directly Ram? Hello, Ram.
Sir is not there.
Hello. Hello.
Sir, give me a minute, sir. Because I stopped sharing, it's not coming again. Madam, madam, screen share మీరు చేయగలుగుతారా ఒకసారి చూడగా నా దాంట్లో రావట్లేదు. అదే co-host మీరు ఉన్నారు కదా ఒకసారి చూడండి. Sir, in moment of this thing, I was trying to get back to you connection, so I stopped the sharing your screen. Just a minute, sir. Madam is starting to share it. I request all the participants to be please bear with us. In a few seconds, it will be shared by the co-host.
Yeah, no problem. Take it.
Okay, ma'am. Yes, sir. Madam is here. She's starting to share the screen.
Okay.
I'm extremely sorry for taking up your time.
It happens sometimes. What to do? Despite advancement. So what we can do possibly is
Yes.
forget about the slides. I can speak without a slide. Just put the image and we can keep going. Don't worry about it. Okay.
Madam started screen sharing, sir. It is going live stream also. So I think she's trying for that.
Okay.
Madam, 14th slide.
Yeah. So the slide number 14, please. Okay. As the slide comes, I will just start talking about that slide. There is a very famous, sorry for all the inconveniences, and sometimes man proposes, machine disposes now. So we have to we should be highly, you should be prayerful, you should be devoted today to machines today, because fine day you're working, suddenly computer crashes, your mobile crashes, or your driving car crashes. So that's the problem now. So, okay, so there is a very famous published study called as, slide number 14 as we go. Very famous study published in Irish Medical Journal, okay, which says that recently they looked at the mortality rates of COVID-19, very high. Can you hear me? Hello?
Yes, sir. Yes, sir. It is clear.
Yeah. Okay. So they've done a They've done a study with the low levels of vitamin D and relationship with COVID patients. They found people with the low COVID level, vitamin D levels of less than 40 nanogram per ml, had a high incidences of COVID-19 mortality that was found in Italy and Spain, compared to Sweden, Norway and Denmark, where the vitamin D levels were about 60 to 70 nanomoles per liter. So this is the Scandinavian population, which is the Scandinavia is a country where you have all those large countries like Finland, Sweden, Norway, comes under Scandinavia, and have a higher amount of acquired immunity compared to others who has to have an adaptive immunity. So as a result of it, this is a recent study which very clearly shows that there is some relationship between vitamin D and mortality of COVID-19. Okay. So now slide number 16, I will go to slide number 16 because I can't see any slides moving here. Slide number 16 today will talks about COVID times. Okay, so slide number 16, please. These are all slides I spoke. Okay, okay, nice. I'm going to share the slides. Okay, so slide number next 16, please. 16, please. Okay. So slide number 16 talks about today with COVID time, loads of interest is emerging in field of immunity. And hence I thought it is apt to present vitamin D and omega-3. You have now understood cellular and regulatory mechanism, how it can help in supporting innate and adaptive immunity, immunological mechanism through the response of macrophages, neutrophils, basophils, and natural killer cells, eosinophils, and dendritic cells. However, this is immediate. It can serve as a long way, one to protect them from external insult or injury. These are non-specific, but it's important. However, adaptive immunity can be improved by physical exercises. Very important. Every day, one has to spend about 20 minutes on cardiovascular exercises, not just weightlifting. You don't need to do a lot of weightlifting. Weightlifting can be done with a small dumbbell, 5 kgs to just strengthen bones and muscle. You don't need a six-pack. That's all mainly for film stars. But for a healthy body, you need a good thing. You need a good cardiovascular exercises. You need every day at least 20 minutes of walking, running, very brisk walking if you are doing it, so that your heart rate and pulse rate and oxygen saturation is very, very good, so that you are protected, well protected. However, Adaptive immunity can be improved by nutritional diet and also healthy lifestyle. Sleep well, have good friends. Don't think too much about future. Think about today. Have a nice relationship. They are very, very specific kindled. These all will kindle a very important component in the body called lymphocytes. Lymphocytes in the body has a natural ability to acquire through production of B cells and defeat T cells in the body. And vitamin D and omega-3 as an additional role in influencing this later. Okay. Next slide, please. Slide number 17, please. Now, coming back, I said about immunity, it's important for me to talk about inflammation and stress today. You know, body contains beautiful amino acids called as tryptophan, and tryptophan is an aromatic amino acid. So you know we have 20 amino acids in the body, 20 amino acids, of which some are essentials, some are non-essentials, are aliphatic amino acids, something are aromatic amino acids. One amino acid which is very, very important in the body is a combination called as branch chain amino acids, that BCAA. The BCAA contains leucine, isoleucine, and which is important. There is always an imbalance between the role of aromatic amino acids to aliphatic amino acids. Branch chain amino acids are very, very important for your skeletal muscles in the body, so that you are physically fit, so that you can run, walk, exercise, and to improve your vascular activity, or to do yoga or Surya Namaskara or whatever you want to do. Very, very important. But at the same time, aromatic amino acids like tryptophan are very, very important, because tryptophan is responsible for producing a very, very important neurotransmitter in the body called as 5-HT, which is also called as 5-hydroxytryptamine serotonin, which is also in one converted into dopamine. So dopamine, 5-HT are very, very important in the body. So the role of body is very, very important to understand that vitamin D and omega-3 has a role and has also a control of vitamin D and control of hydroxytryptamine and dopamine in the body. So next slide, please. Slide number 8. Now, you should understand slide number 18 talks about, there are a lot of references. The slides can be shared with you. Now, you understand very clearly that your serotonin has important body function, brain function. It controls your behavior. So that includes your sensory system, your attention deficit hyperactivity disorder, bipolar disorder, impulsive behavior, anxiety, all are related to your production of 5-HT. The 5-HT is also important, can be produced only with a good amount of omega-3 fatty acids. So if you look at the omega fatty acids, presynaptically to use EPA, you need good amount of EPA to produce presynaptic synthesis of serotonin. The reuptake that happens in the postsynaptic receptors are produced by 5-HT is also responsible to the initiation of omega-3 fatty acids and also vitamin D. Please understand vitamin D and omega-3 has a very important role in production of serotonin in the body, which is important for neuropsychiatric and brain functions in the body. Next slide. So I covered the immunity. I covered to some extent the neurology. I will come to the most important. Omega-3 fatty acids is for a long time in cardiology. Okay? Only 10 minutes. Please have patience. I will complete it. Don't worry about it. Omega-3 fatty acids, vitamin D is in cardiology. So there are 3 important studies that are undertaken. Slide 19. Hello. Hello. Hello.
Please kindly mute yourself. Participants, I request all the participants, please mute yourself. Request all the participants to please mute yourself so that there will be a discussion.
Hello? 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 Yeah.
You can start, sir.
Yeah.
Yes, sir, you can continue.
Okay. So omega-3 has an important role in cardiology. See, if somebody is continuously talking, I can't speak. They should speak.
Yes.
It's completely inhuman, and it's not method at all, right? You are disturbing the flow. So there are three important studies that has been studied in cardiology. One is a famous GISSIP study, Italian study. There is a beautiful study called Reduce Heart Failure Study. And third is called as a vital study. Okay, next slide. I'll talk about that little details next. Slide number 23. The famous study of omega supplementation is called, in very popular study called as Gruppo Italiana Lo Studio della Sopravvivenza nel Infarto Myocardio. It's very complicated. The Italian group of study of physicians who did the study on survival of myocardial infarction, heart attack. They did a study, a pragmatic trial on patients with recently myocardial infarction, and it was conducted in the framework of Italian public health system. In GISS Prevenzione study, 11,323 patients were enrolled in the study trial. At this study, they give a combination of omega-3 and vitamin E. Patients were invited to follow Mediterranean dietary habits and were treated up to date with pharmacological interventions, preventive interventions, long-term omega-3 fatty acids with 1 gram daily, but not vitamin E 300 milligram was beneficial for death and combined death. Suppose if you're looking at a cardiovascular study, we'll always measure mortality and morbidity. Mortality means death. Morbidity means disease. How many people are getting recurrence of cardiovascular diseases? How many patients are dying of heart diseases? How many patients are not dying due to heart patients? If you look at overall, we see continuously administration of omega-3 fatty acids. Hello, can you hear me? Omega-3 fatty acids, as they reduced overall cardiovascular morbidity by 20% and sudden cardiac death by 45%. So this clearly shows that omega-3 fatty acids has a role to play. So slide number 21, please. So there's another study which followed after this study called as Reduce It study. So in this study, it's a double-blind randomized patient study with fasting triglycerides of 139 to 499 per deciliter, with the low density lipoprotein LDL of 41 to 100 milligram per deciliter. The patients were randomly assigned to 2 gram of one type of fatty acids called as icosapentaethyl twice daily. Their primary endpoint was cardiovascular death and non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, and unstable angina. So now the next slide will give you. Next slide, please. The next slide talks about, that's slide number 22, talks about total of 8,179 patients was enrolled. See, look at the GISS-3 study was on Prevenzione study. Prevenzione means preventing study. It's a prevention of cardiovascular diseases. Now we have talked about secondary prevention. Somebody who was already had a heart attack. Now we are going to give them omega-3 fatty acids and following up for about 5 years. They followed up to see whether they had a recurrence of myocardial infarction or not. And they looked at the recurrence of these diseases. They found that there was a reduction of total of about 4.3%. If you look at the entire primary, 22% of the patients in the placebo group had a chance of getting heart attack. 22% of the people in the normal treatment with omega-3 had a good conditions. Thereby, there were the total reduction of cardiovascular death and total reduction of secondary effects was seen in amongst the patients who have been treated with secondary prevention. Then came the third important study called as a vital study. Slide number 23, please. Vital study is the largest ever study conducted. Next slide. That is 23. Slide number 23, please. So this is about 25,871 healthy men and women were. This is also a prevention study. Now, vitamin D were given at 2,000 international unit per day. Today, the recommendation dose is 10,000 international unit per day. And you have to take every day vitamin D. And the recommended dosage of EPA, I said about 3 grams for cardiovascular prevention. For triglyceride reduction, it is about 6 grams. But still, the recommended doses here in this study is 1 gram. So about 12,000 subjects took vitamin D, out of which 6,463 patients took omega-3 fatty acids, and placebo, it was compared against the placebo. Placebo range also had 6,470 people omega-3. Next slide, please. 24th slide. Slide number 24. The 24th slide, which talks about slide number 24. Now, if you look at this study, if you look at the patient, statistically, if you look at the slide, extreme light hazard ratio, and compared to placebo, the major events you can see is reduction of total myocardial infarction is reduced to extent of 28%. 0.72 is a very good indicator. It shows reduction of total myocardial infarction. Total fatal MI come down to other cardiovascular events. Fatal MI is reduced by 50%. Total cardiovascular death is reduced by 76%. Total CHT is reduced by almost 17%. And interventions is reduced by 12%, which very clearly shows the usage of vitamin D and omega-3 fatty acids has a healthy effects on your heart. Next slide. Slide number 25. Okay, so coming to the conclusion, the last slide which I want to talk to you before I wind up my talk. I will not go to 28th slide, but I will end this slide at 25th. Now, in this slide, I want to tell you that several studies have shown that omega-3 fatty acids, vitamin D, has benefit both for you in immunity. It is going to help you in neurology. It is also going to help in cardiology. If you look back, you always understood how omega-3 has a role to play in your body, how vitamin D has a role to play in the body, what is a basic mechanism of action, how it is going to protect your thing. There are several clinical studies. I should tell you that none of the drugs, none of the chemicals has studied so much as vitamin D and omega-3 fatty acids. Studies are in the websites. If you go back to the literature and review, you may not find any other chemicals as much as studies as omega-3. I want to extend you to tell you this. You have seen through hydrochloroquinone, HCQ today, there is a cardiovascular problems associated because of pH. Now, if you use that with omega-3, it is found to reduce it. So omega-3 is a universal thing that you have to take every day in your dietary substance, so as vitamin D. So I want to tell you, re-emphasize that you understood what is vitamin D, what is omega-3, how it has a role in the body, how does it going to impact your resistance in the body, how does it going to neurological effects in the body, how it's going to use cardiovascular. I've shown you a number of studies how it has impacted. Unfortunately, it's not as good as talking over as a lecturer, but it is still better than how I could communicate, how much I could communicate over the Zoom. I'm not really sure because I do not know the responses here. Here and there, I had some disturbances through electronics and through some of the people communicating directly. Overall, I want to tell you at the end of the day, vitamin D at about 5,000 to 10,000 international units daily. Omega-3 between 1 and 2 grams every day is very must for your body. Please take these two things which is helpful to your body to maintain a good immunity, good cardiovascular health, good neurological. Do exercises, spend at least 20 minutes every day walking or doing running or do some physical activity or spend some time. You have to have a good sleep. Good human being, good normal human being needs 7 to 8 hours of sleep. Or when you get up in the morning and you feel drowsy, you trust sleep. But if you practice meditation, you can reduce your sleep to 5 hours, 4.5 hours a day. And also, many of you, I want to tell you that there are a lot of good online courses available today. Upgrade your skills. There's one fantastic place is something called EDX is a course that you can take a certificate programs. I had a privilege of going through certificate programs, getting in last 2-3 months on molecular biology, neurosciences, and also on biochemistry. It's very important as students. You should be in lecturers to be in forefront to understand newness in science, newness in molecular biology, newness in genetics, newness in learning of RNA and DNA. There's so much science has changed over a period of time. We should be knowing that we cannot use our old textbook and say that what is going on science is important. No, science has changed a lot and it is every day evolving, revolving. The beauty of cell membranes have changed, the beauty of organelles have changed, the nuclear receptors, nuclear proteins. How does the DNA sequences have changed? The methodology of understanding PCR reactions have changed. So please take your time and go through. I'll be more than happy to answer your questions. Otherwise, wonderful talking to you. Thank you very much. And once again, my sincere apologies on behalf of the organizers for just in technical stuff. Thank you very much. Hello.
Thank you very much, sir.
Yeah.
I request, thank you very much. I request all the participants for your questions. You can directly speak to sir, and